Hello, Dr. Carhee. I'd like to share with you about your stress headaches. In particular, 3 therapies that might help you with the symptoms you're feeling, such as pain, such as muscle spasm, such as restricted joints in your skull, and actual pain and headache going from your skull up the top of your head. Now, once you receive these therapies, it will help you work fuller and enjoy a full day's work without having that nagging headache all day. Then it will help you sleep, a full night's sleep, or not wake up with that pain in the head. And it will help with your daily activities, such as combing your hair, or trying to shower, or bathe yourself without having a nagging headache. And it will help you when you're standing for long periods of time, or reading without having pain or throbbing in the head. Over my 11 years, I found there to be 2 main causes to tension or stress headaches. Number 1 would be the spasm of the muscle that's at the base of your skull, occluding the occipital nerve that travels at the base of the skull to the top of the head. Number 2 would be the upper cervical joints that may be restricted, the bones at the top of your neck that would occlude or irritate this occipital nerve. Also could cause this stress or tension headache. With over 3,000 patient visits, I found there are 3 therapies in particular to help with this tension or stress headache. Number 1 would be chiropractic joint motion therapy. Number 2 would be myocurrent stimulation. Number 3 would be massage therapy. Let's talk about chiropractic joint motion therapy. That's where we locate the painful, the spasm, or restricted joints and deliver a light pressure. This light pressure will promote moving in the joints, allowing the muscles surrounding the joints to relax and allowing the joint to be free of pain or restriction. Number 2, myocurrent therapy is where we find the painful area, place 2 pads over the painful area, and run a small current through the muscle. Now this would act as a block to the pain that you're sensing, and it would also decrease the spasm or restricted muscle, allowing it to relax, enabling the joint to move freer. Number 2 would be massage therapy. Now, this is where we find that tightened connective tissue, the shortened muscle, and we manually lengthen that muscle or tendon, and that will enable it to not have the pressure on the occipital nerve and allow the connective tissue to relax. This would cause the muscle spasms to be reduced. It also will result in the muscle tension or pain to also be reduced. Many patients have great results when receiving these therapies. In particular, there's Carla, who is suffering from an occipital stress headache. Upon Carla's first therapy with me, she felt 80% better. And in 10 days, Carla felt 100% better. Now, many patients have great results, and the reason they choose my office is actually because I'm centrally located, 1 mile outside of 285 on Cascade Road in beautiful southwest Atlanta. Number 2, I'm on the board of the Georgia Chiropractic Association, who helps protect and promote the patient's right to choose their healthcare provider. Number 3, I'm the president of a national Black Chiropractic Association, which promotes chiropractic care in underserved communities. So, I would like to offer you a $47 new patient special, which is 75% off of my normal rates. The reason I'm offering you this new patient special is to make it easy to see if chiropractic care is right for you. There are 6 parts to this new patient special. Number 1, the consultation, where I will sit down with you and find out exactly what's causing your injury or why you're having this tension headache. Number 2, I'll find out all the anatomy parts that are involved, and we'll find out which therapies will get you out of pain the fastest. We'll even do range of motion testing to see which joints are restricted Then we'll test the muscles and find out which muscles might be involved in your occipital headache or your tension headache. We'll then test the nerve to see exactly which nerve is involved. Is it occipital nerve or the upper cervical nerves? And are they causing you pain? Then we'll also test your joints in orthopedic joint testing. We'll find out which joints are involved, are causing you pain, which tendons, ligaments, or which cartilage might be involved and might be painful. Once we know your specific anatomy, we'll then know exactly which therapies to give you in order to get you out of pain the fastest. In addition, we'll offer you a free massage session, which will target these spasm muscles and target these painful muscle areas, giving you relief on your first visit. There's a two-part guarantee. If during our examination we find out that your case is not a chiropractic case, we'll refer you to the appropriate specialist. Number two, if you're not 100% satisfied with your examination, then there'll be no charge for your visit and you still get to keep your free massage session. Now remember, this is limited to the first 10 callers of any calendar month. So, if you are suffering and in pain, be one of the first 10 callers. Call me at 404-699-0966.